Hi, good evening, everyone. Hopefully you can all see me and hear me. My name is Amy Barrie. I am the lab manager for Care Chester and for Care Liverpool. Welcome to your virtual information event. So hopefully we've got a good session lined up for you, lots of information and lots of questions being answered. So we're here to give you everything, all the information that you need, hopefully, to start your journey. But I'll just run through the order of events. So am I back? My screen just went blank. I'm getting some, getting some feedback to say that I'm back. Sorry about that. I'm not sure what happened. I am not in a place that I usually am, and I'm hoping that my signal holds out, so fingers crossed. But we do have Professor Charles Kingsland joining us, so he could take over if things go terribly wrong. Just let me know in the messages if you're struggling to hear me or if I disappear again. So yeah, I'm going to go through a quick presentation, not that quick actually, but it's basically going to take you from start to finish of a treatment cycle, and we'll go through some of the additional things that Care have to offer our patients. We'll do a Q&A session after the presentation, and there'll be some videos in between showing you some of the techniques that we use in the lab, and then hearing from some of the other care team. We've got lots of people in the background who are here to answer questions. There's 7 or 8 of them, and they'll be messaging you back if you put anything on the chat. If you do put anything on the chat, then everyone can see it. So if you'd rather not, then you can put it in a different place. I can't remember what that was called. Yes. Oh, sorry. If you put it in the questions tab, that's the private tab. But if you don't mind it being public, then it can go in the chat. And the people behind the scenes will answer your questions as we go. If we don't have time to answer your questions either in the chat or in the Q&A session, then we'll answer the questions via email. And if you think of any questions after the event, you can get in touch with us on multiple different ways, but main way you can get in touch is through the email address, which is events@carefertility.com. And you can also contact our new patient inquiries team up until 8 p.m. tonight. So they're ready and waiting to answer the phone and answer your questions. And you can reach them on 0800 564 2270. Okay, so I think that's everything. I've said that we're going to be joined by Professor Charles Kingsland, and he'll be answering some of the clinical questions. So we'll start off with a video that'll just kind of set the scene.
Family. It's who we are and who we're always going to be. It's the important little moments, the big emotions, the beating heart at the centre of our world. It's the journey that we take there, together, one step at a time. Family is the one thing we'll always care about the most, because we believe that family is for everyone. And through our care, we'll do everything we can to make your dream real. We don't just care, we are care.
My name is Professor Charles Kingsland, and I'm the Group Clinical Director for Care Fertility. At Care, our number one belief is family for everyone. And this means we do everything possible to help everyone start or grow their family. We know that nothing is as important as family, and that's why we care so much about wanting to give every patient that comes to us their best chance of having a baby. Of course, families come in all shapes and sizes. We get heterosexual couples, couples of the same sex, we get single patients wanting to start a family, we get NHS patients. When you have a fertility problem, there should be facilities available for you to get the best advice and the best treatment readily available to give you the best chance of having a baby at a time in your life that is best for you. We will use all our knowledge and experience combined with highly individualized treatment, personal treatment, to help you have the family you are longing for.
Unbeknown to Gemma and I, we both carry a gene, a deafness gene. We actually have a daughter who was 3, but who was born prematurely deaf. And we were given the option and chose to go down a fertility treatment to kind of avoid our second child having that same gene.
We were very lucky in the fact that the clinic was only down the road from us. So we felt there was one around the corner. It had good reviews. We just felt it was good for us, didn't we?
The whole package made us just feel really comfortable that actually going with Care was the right decision.
So the team that we worked with at Care were unbelievable. They were caring, they were sensitive, they were compassionate, empathetic. And even when I was ringing out with I was feeling pains down one side, that the reassurance that they gave me, they honestly do hold your hand every single step of the way, and I feel like they lived the journey with us.
So I've had several treatments with Care, and I now have a baby, and that's taken a number of treatments, fertility treatments, different alternatives, different medicines to try and get it to work for me. I have always said I would recommend Care Fertility. I would recommend them for the comfort factor that I received, the friendliness, and just I think the word is my faith in Care Fertility.
Okay, so we'll start the presentation. So hopefully you can all see my screen. So first of all, it's definitely worth saying we really do believe that family is for everyone. So we do, as the video said, we do treat all different types of people, same-sex couples, single patients, and we really do believe that families for everyone, and we want to help you try and achieve that. And one of the things that we think is really important is location. So we have lots of different clinics all around the UK. We've got 13 or 14 main clinics, and then we've got a few little satellite clinics in there that feed into our main labs. We even have one over in Ireland. So we do try and make all the treatments as accessible as possible to everyone across the UK. So going through this presentation, I am going to talk about the general IVF procedure as a whole. So although we do treat lots of different patients, that you will have a specific treatment plan for you. Some things that I talk about might not be relevant. But generally, the process of an IVF treatment cycle is roughly the same. So we'll talk about it in general terms, and hopefully you find some of it useful. So it's really easy to get started with Care. We've got tons of people in the background here today to help you answer questions, and we've also got lots of people in our general inquiries team. So this is Shah, our general inquiries team manager, and we've also got Lauren, who's our new patient teams manager, our events team manager, and she's answering all your questions and being very helpful in the background, and Shah is always very helpful as well. So as I said, we've got the inquiry team open till 8, and you can get in touch with us anytime on the number that I gave, and also on the email address. So it's really easy to get in touch with us and get started. So the first thing that we really need to do that's really important is to get the right diagnosis. That's going to inform everything else that follows. So make sure that we're giving you the right treatment, the optimum treatment. So getting the right diagnosis is really important. So we want to take the time to get to know everything about you. If you've had previous treatment elsewhere, then we want to know the outcome, and we want to know any test results that you've had or any tests that you've had in the past. And we want to be able to see all of that information. So we will send you detailed questionnaires for you to fill in so that we can get as much information as possible about you and your history. And we'll ask you to upload previous medical notes or test results to our secure online portal. And all of this information would be reviewed prior to you coming in for your consultation. So the portal is really good. It's secure. You can access it on the desktop, on a laptop, on your mobile or a tablet. So it's really quite straightforward. And it's basically a two-way portal. So we will send you information to that, but you can also send us information back. So in the first instance, getting started with care, we would ask you to upload any information that you have that's relevant to your treatment history. And you'll do that up onto the portal, and we'll get an automatic alert to tell us that you've uploaded something. And that makes everything really seamless and really easy. So then, once we've got all the information that we need from you, we'll get you in for a consultation. So this will be where we talk to you about your plans and what your wishes are for your treatment, and any test results that you've had. We'll talk through those, and we'll talk through the treatment types that we think are going to be most relevant for you. We've got lots of different treatment options, and they're not appropriate for everyone, but the doctor in your consultation will talk you through the ones that are most appropriate based on your history and test results. So we'll give you really detailed information about the treatment options, and you can go away and consider those in your own time. We'll let you know how to access support, give you a bit of information about costs, and really we'll give you all the information and the time that you need in that consultation to feel like you're starting your journey well. So really, whether the problem is simple, whether it's straightforward, or whether it's complicated, you've had multiple treatments somewhere else, and there's really a lot to talk about. All of the consultants that we have got a real depth of experience, and our aim is to give you the best chance of starting a family. So once you've had your consultation, we've decided on your treatment plan, we'll then get going with the IVF process. So everyone's different. There will be individualized treatment plans. And as I said, this is just a general overview of an IVF process. So the first step is really to stimulate the ovaries. And we do that with some drugs that are given through an injection. And we'll stimulate the ovaries to produce follicles, which should have an egg in. So here you can see a few pictures of Diane showing you how to do injections, and this is all taught online, so it's all really accessible for you, and there's no need to be in the clinic more often than you need to be, although clinics are very close by, and we like to make things as easy for you as possible. So this will all be online, and you can look at it when you want and go back and refresh your memory. So we'll stimulate the ovaries to get follicles developing that hopefully have eggs inside, and there'll be a couple of monitoring scans, perhaps one or two, throughout the time that you're taking those stimulation drugs. And those scans will basically tell us how well your ovaries are responding, and it will inform us of when you're ready to have the egg collection. So when we think that there's enough follicles developing, we'll advise that it's time to take the final trigger injection, and then you'll likely come in for egg collection a few days later. So the egg collection is really straightforward, 20 minutes, 15-20 minutes. You're up and about afterwards within the hour, and all we do is pass a needle through the vagina into the ovaries to aspirate the fluid from the developing follicles, which will hopefully contain an egg. So we've got the eggs. We obviously need the sperm to create the embryos in a normal IVF pathway. So the sperm is usually collected on the same day as the egg collection. We need to put them together on the same day, and usually it's produced through masturbation. Sometimes that we can retrieve sperm surgically, and sometimes some patients might already have some sperm frozen at another clinic that's been transferred in. But usually we have a fresh sperm sample on the day of the egg collection. So there is a video here to show you about sperm analysis. So this is a short video of sperm. You can see swimming in the middle, and there's blue lines following the sperm as they're swimming. So this is what we call a computer-aided semen analysis, and this tells us how many sperm are in a sample, how well they're swimming, and what the sperm look like. And those are the three main things that we look for. Is there a good number of sperm? Are they swimming in the right direction? And do they look nice? Okay, back to the presentation. So we've got the eggs and we've got the sperm, and now we obviously need to put them together. So there's two different ways that we can put the eggs and sperm together. First way is standard IVF, and this is where we've got a good number of sperm. They're all swimming in the right direction and they all look good, and we put 200,000 sperm in with the eggs and leave them overnight and let them do what they're going to do. The other method of fertilization or insemination that we use is something called ICSI. So ICSI is where we have a lower number of sperm. Perhaps they're not swimming all in the right direction, and perhaps they don't look as normal as they should. And with ICSI, what we can do is look under a microscope, a much higher magnification microscope, and select a sperm that looks good, swimming in the right direction, and we can manually inject that into each one of the eggs that we have collected for you. So I think I've got a video of ICSI as well to show you. Let me just share that. So you'll see in the ICSI video, you'll see the egg in the middle of the screen, and that's being held in place. And then you'll see the sperm just coming down the needle on the right-hand side. The needle gets pushed into the egg, and then we gently suck some of the egg into the needle to break that outer membrane to make sure that the sperm definitely goes in. Deposit the sperm in the center and remove the injection needle. So we do that for every one of the mature eggs that we have collected for you. So the average number of eggs collected is anywhere between sort of 8 and 10. Some people get more, some people get less. Obviously, it completely depends on your response. And then usually, if it's ICSI, usually around 80% of those eggs would be suitable for the injection. So if there's 10 eggs collected, then probably 8 of them would be suitable for the injection. And then once we've done either the IVF or the ICSI, the eggs are left for around 16 to 18 hours, and then we check for signs of fertilization. So we're looking for specific things within the eggs that show us that the egg has fertilized, and the fertilization rate is about 70 to 80%. So if 10 eggs were collected, 8 perhaps were injected, maybe 5 or 6 would fertilize, and that would be good. So once we've had the fertilization check, that's the first check that we do with the eggs, and then we leave them to it, and then we check them again a couple more times. So this will depend on what treatment options you select, but if you were to select our Care Maps system, that's the incubator that you can see on the screen here that Alex, our lab manager from London, is playing with. So this incubator has got a camera inside it, and it takes a picture of the embryos every 10 minutes. And that means that we can leave the embryos completely undisturbed in the environment that they like, and we could look at them as much as we want to. So we would do normally, if they're in the Care Map system, we would do a check on day 3 and then another check on day 5. If you don't opt for the Care Map system, then we like to leave the embryos undisturbed. We don't want to take them out of that optimal environment as much as possible. We'd like to leave them in there. So we don't do that middle day 3 check. We just do a morning of the day 5 check, and we ring you and we let you know how they're developing. So you can see it here in the bottom right hand corner of this image. There's a couple of stills of embryo development. So the top left one is fertilization. We can see 2 circles in the middle of the egg, and that indicates that it's normally fertilized. And then we can see it at the 4-cell stage, which is the top right hand side. And then the 8-cell stage, which is around day 3, which is the bottom left, and then through to a blastocyst, which is where we want it to be on day 5. So we will contact you all the way through. We'll contact you after the fertilization check, and we'll contact you on day 3 if you've opted for care maps, and we'll contact you again on day 5. But obviously we're always on the end of the phone. If you did have any questions throughout, then you're welcome to get in touch with us if you wanted to. So once we know that we've got embryos and they've developed nicely, we'll get you booked in for your embryo transfer. But first of all, obviously, we want to talk about the maximising your chances of success. And there's 2 things really that we think can help with that. The first one is care maps that I've talked briefly about. The incubator that has got a camera inside, and it takes a picture of the embryos and gives the embryologist lots and lots of information about how which embryo is the best one for transfer or for freezing. And the care maps technology, the method that we use for the embryo selection is entirely is individual to care. No one else has the same thing that we do, and we use software to tell us which embryo has got the highest chance of giving you a baby, and it will give the embryo a score from 1 to 10. And this has been developed on over 6,000 data points, lots and lots of data, which has given us a really, really good way of ranking the embryos. And we're able to give you that information. We're able to tell you what score the embryo has, and therefore what your chance of taking a baby home is. The other thing that we offer is something called PGT-A. So this is pre-implantation genetic testing for aneuploidy, and that's that picture on the right hand side. So this is a blastocyst, and we're taking some cells away from the blastocyst in the pipette. And this is where we would send 5 to 7 cells of a developing blastocyst away for genetic testing. We'd freeze the embryo and we'd wait for those results to be returned, and then we'd know whether the embryo was more likely to be normal or not in terms of chromosomes. So this is only really applicable for certain patients, and if we think that it's appropriate for you, then we'll talk to you about it in your consultation, and we'll give you plenty of information about PGT-A. So the embryo transfer procedure should be relatively straightforward. Walk in, walk out, very like a smear test. So there's no sedation. You're awake. There shouldn't be any pain. You would be awake for the whole thing, and this is obviously the important part where we select the best embryo to transfer for you based on care maps information or PGT-A information, and then we would pass a soft catheter through the cervix into the uterus and deposit the embryo in the uterus. So here's just a picture of the kind of thing that it looks like. Most places do embryo transfer under ultrasound guidance so that we can see that the embryo is going back in exactly the right place. So before we move on past the IVF process as a whole, I've just got a video about maximising chances of success. So this is just a really, really quick video showing you the development of an embryo. So it starts on day 3. This is the kind of video that we'd end up with for your embryos if you chose care maps. And then as we move from day 3 into day 4, we start to see this fluid accumulating in the center, and the cells will start moving towards the outside. This is it forming a blastocyst, so where it would be on day 5 or day 6 of its development. And we would use this information to help us pick which embryo had the highest capacity of creating a live birth for you. We also would share that video with you So we would send that to your portal, and that would happen straight after your embryo transfer. You'd get a notification to say that you had your video of the embryo that you had transferred. And this is only if you select the care maps. Okay, so following the embryo transfer, there's obviously the 2-week wait. This can be a tough time for most people. We don't have much contact with you in this time, but you are always welcome to get in touch with us in those 2 weeks. If you wanted to just talk about anything, if you had any thoughts after your transfer, welcome to get in touch. But once you've had your embryo transfer, the pregnancy test is about 14 days afterwards. And we'd ask you to give us a ring either way, whether it's positive or negative. And then we can sort out what happens next. So if it's a positive test, great, we book you in for a scan a couple of weeks later just to check for a heartbeat. If there's a heartbeat, then we would discharge you to your GP to normal antenatal care and wish you well. If it's negative, obviously, we would offer support, and we're there for you every step of the way for anything that you need if that does happen. Okay, so just to move on to some additional things that we offer at Care. So donation is a really big part of the treatment offerings that Care have. We've got a really large donation team now, over 25 years of experience with donation, and we've helped more people start a family with the help of a donor than any other clinic. So this is both egg and sperm donation, and we'll support you through the entire process. So from the initial questions all the way through to helping you select your donor, having the treatment, and hopefully having the outcome that you want. And we have specialist counselling for this type of treatment as well. There's obviously an added layer to treatment with donor eggs or sperm, and we want to be able to support you through that entirely. Support at Care is something that we're really proud of. We've got lots of different support mechanisms in place for you. Counselling is free. We think it's really important that everyone has access to counselling as much as you need. So we've got specialist fertility counsellors. It's all via Skype at the moment, but that makes it can make it more convenient for you, and you're welcome to access the counselling at any point in your pathway. It doesn't have to be at the end, it doesn't have to be at transfer, it can be right at the very beginning if you needed it. So you just need to let one of the team know that you'd like to access counselling, and we can get that arranged for you. We've also got a Care Buddy system, so you can find out more information about this on our website. But this is where we would buddy you up with another couple or patient going through the same treatment, and you can support each other through each stage. We run regular support events and online support groups. So we do something called Walk and Talk. We've recently been able to start that back up, and hopefully it can carry on. But we get together and go for a walk and have chat, which is nice. And we've got a 24/7 online care forum as well. So there's loads and loads of patient forums out there, and they can be really useful. But we have a specific care one, so it's really helpful for talking about care pathways and other things that people are going through in other care clinics. You've always got us on the other end of the phone as well. So if you needed to call anyone, speak to anyone, you just ring your clinic, and they'd be happy to help. So another thing that we're really happy about is being able to offer something called Care Pay. So these are exclusive IVF funding programs to make funding treatment easier to manage. It's completely in-house. You don't have to go to a third party, and we have multiple options available. So a multi-cycle program, a refund program, and a donor egg IVF refund program as well. So we created Care Pay because there was some feedback from patients that it was disruptive to have to go out to a third party to get funding for treatment. So we moved it in-house to try and make it a more seamless experience, and it makes it more personal and private for you as well. So in the Care Pay programs, they all include cycle monitoring, egg collection, all of the embryology, embryo transfer, freezing and storage of any embryos, unlimited embryo transfers, blastocyst culture, and care maps, which is obviously an extra benefit to help give you the best chance of success. So I think we're ready for Professor Kingsland for the first Q&A. We've had lots of questions coming through. I should say that I've got a little bit of a cold, so if I sound a bit bunged up, then that's why. I'm also coughing a little bit. So I'm just going to see if we've got the professor joining us. He should be here any second. Oh, can't see you, but I think we can hear you. Nope, it's gone again. Okay, well, I'll start with some questions that we've had sent through earlier. So, do care do PGT testing? Yes, so that's one of the things that I talked about. That's the PGTA, and that's available in all of the care clinics. So you can talk more about that in your consultation if it's something that you would be interested in. Do we provide sperm for same-sex female couples? Oh, is he back? Hello?
Hello, can you hear me?
Oh, I can hear you, but I can't see you.
Oh,
Oh, no. I think he keeps trying to turn his video on and pressing end. Never mind. We'll carry on and he'll get there. There are a couple of clinical questions, which I won't answer, but hopefully Professor Kingsland will join us. If not, then we will absolutely get back to you afterwards. So do we provide sperm for same-sex couples? Yes, we do. We like to treat every different type of patient. We want to make treatment accessible to everyone. So we will provide lots of support for choosing a donor and bringing the sperm in if you were to use an external bank, which we allow, and also we have our care sperm bank as well. So we have our own bank of sperm donors. If you don't ovulate naturally, can you still have IVF treatment? I'll leave that to the professor. Can I have a surgical sperm recovery if I have a heart condition? Again, probably one for the professor, but the likelihood is we would do what's called an anaesthetic view. So you've put here that you're worried about the anaesthesia. Yes. What we would do is give your information through to a consultant anesthesiologist, and they'll review your background, your history, and see if it's appropriate for you to have anaesthetic or not. Sometimes we can do a surgical sperm retrieval without general anaesthetic. You can do a local anaesthetic, but those sorts of things we can talk to you about in a consultation. What makes an embryo unsuitable for transfer? So we generally do transfers when the embryos reach the blastocyst stage. So this is the furthest on stage that I showed you originally, the picture where it was getting bigger and we were having that fluid accumulating in the centre. We would ideally like an embryo to be at that stage for us to deem it suitable for transfer, but there obviously are different grades. So some embryos develop better than others, and some embryos can be so particularly poor that they are really unlikely to create a pregnancy. We would obviously give you all of that information before we made the decision. But an embryo really has to be going through that advanced stage of development for us to think that it's suitable for transfer or for use. Okay, so those were most of the questions that I'll touch on. So monitoring of embryos. Yes, so I guess a bit more about the care maps system that we have. So this is it's really quite novel, and not a lot of clinics use it or have access to it. It's quite expensive, but we are lucky that we've got it in all of our care clinics, and if you opted for the care maps, then we can do some really close monitoring of the embryos whilst they're in the optimum environment. So we would look at them on day 3 and we want them to have around 6 to 8 cells. We'll ring you and we'll let you know if they're at the right stage, and if they are good quality or not. And then again, we can look at them on day 5, watch the last 2 days of footage to see how they've developed, and then we get a score from 1 to 10 to tell us the likelihood of the embryo creating a live birth, creating a baby for you. So that's a really good bit of technology that we can offer as an addition to any standard treatment. Okay, so I think Professor is trying to get back on. So I'm just going to have a look at some of the questions that we've had coming through. Most of them have been answered. Let me have a look. Is a hatching blastocyst the optimum? Not necessarily. So an embryo can be really nicely developed, but not yet be hatching. Hatching is probably the latest stage of embryo development that we would be able to see in the lab. And it does tell us that the embryo is able to get out of that outer shell, which is what it needs to do to implant. But just because an embryo isn't hatching doesn't mean that it's not going to get out of the shell. So lots of the transfers that we do aren't on hatching blastocysts, and they create pregnancies. So no, I wouldn't say that hatching blastocyst is optimal. After 2 IUIs, we're changing to IVF. After the tests have been done, how long do you need to be injecting before you go to egg collection? So the injecting of the stimulatory drugs can be between sort of 8 to 12 days. It's usually 10 days, but it could be anywhere between sort of 8 and 12, and it will really be dependent on how you're responding, what kind of dose we think you need, and we'll monitor that through your stimulation as well. Do your team do AMH testing? I live in Nottingham. Yes. Yes, we do AMH testing. You've put here it's not available on the NHS. There's a different test that some clinics do, which tests a different hormone called follicle stimulating hormone, and it's kind of similar, measures a similar thing, but we think that AMH is a lot more accurate and gives us a better picture of how you're likely to respond from to the drugs. So AMH measures what we call your ovarian reserve. So how many eggs we think you've got left, and it's really important, a really important measure for us to have, so that we can optimize the drug dose, so that we don't overstimulate you, we don't get too many eggs and make you poorly, or we give you too few drugs and then we don't get enough eggs. So we would always recommend having the AMH test if possible. Okay, so in the chat, I feel like there's lots and lots coming through, and I've got no concept of time. So I think we've been talking for maybe 5-10 minutes. So I'll just see if I can pick up on any more. There's lots and lots of questions. Thank you for being so involved. I think our team are on it. I think our team are answering lots of questions for you. I think that's going well. Got one here. I've got a low sperm count. What can I do about it? There's a few things that we would recommend you do. There's lifestyle changes we would always recommend you be at your healthiest when you're going through fertility treatment. So reducing drinking, alcohol intake, reducing or stopping smoking entirely, a healthy diet, exercise, and getting yourself into the healthiest place you can be. We can do something called the Sperm Oxidative Stress Test, which is called the SOS test. You can find some more information about that on our website. I can't go into loads of detail here, but what we can do is put the sperm through a machine that tells us if the sperm are stressed or not. And sometimes if they're stressed, it means that the production of them is reduced. So we can prescribe some antioxidants for a couple of months and retest the sperm and see if that's helped with the stress levels of the sperm. So you can find plenty of information on the website and have a look at that in terms of sperm. And there's something called Zymot as well, which we offer, which can combat what we call DNA fragmentation in sperm. So again, lots more information on that on the website, and you're welcome to get in touch with us, the inquiries team, or via email afterwards as well. So without care maps, how often are they checked? So they're checked once at fertilisation and then again on the day of transfer. So they're checked twice. But the beauty of the care maps is that we're not restricted, so we can check them more often. We don't like to, because we think that often more information can be more difficult, but we can rewind, fast forward, pause, play when we've got them in the care map system, which is great. Okay, so I think we'll go on. I don't think Professor is going to join us, but we'll move on with the next lot of videos, and we'll maybe have another session at the end if we manage to get hold of Professor. So the next section, I'm just going to show you a few more videos. So we're going to hear from Shah, who you saw a picture of earlier, from our General Inquiries team, and also from our CEO, Dave. So there we go.
I'm Shah, and I manage Care's new patient inquiry team. We're here to make it easy for you to take your very first step in your fertility journey. We completely understand how nervous and excited you might be when you contact us. This is the start of a life-changing process and hopefully the beginning of an amazing future as a family. So it's really important that we give you all the information you need. That way, we can help you to feel much more comfortable and confident with your treatment. Whatever you need to talk about, I want to reassure you that no question is silly or trivial. We appreciate that there might be a lot to take in at first, but don't worry, we'll send you a clear information pack about the treatments you're interested in, and we're always here for any follow-up queries. My team also manage inquiries about Care Pay, our range of funding packages which are exclusive to Care Fertility patients. When you're ready, we can book you a virtual consultation with a specialist fertility doctor from your local care clinic. So, if you want more information, have a question, or wish to book an appointment, call my team. We want you to know that we are here for you at every stage of your fertility journey. We say that our patients become part of our care family, and it's true. We care deeply about you and your future, and our teams are here to make sure you have all the support you need.
The reason why we chose Care was just, one, the care that they give you, the aftercare that they have available to you, and the fact that they offer different forms of treatment, and they listen to you. One thing that I've identified and what I've noticed when speaking to other people that I've met within the infertility community is there's a lot of clinics out there that don't necessarily listen to you as the patient. It was kind of a one size fits all, but with Care that didn't seem to be the case at all. They took everything into consideration, they listened to your concerns, they listened to you as a person, and they put a package and a process in place that will help you, and fingers crossed, will give you that positive result at the end of it. So without a shadow of a doubt, if I had to go through it again, I would definitely go back to Care.
Oh, the support at Care was brilliant, yeah. I mean, the nurses were brilliant for us. You feel so
looked after,
cared by the whole team. We felt that they did care, and it wasn't just for them getting something out of it. It was actually that
ongoing support.
Yeah, and they wanted it to work for us.
Care Fertility started over 20 years ago with one clinic and the goal of helping patients achieve their dream of family through truly personal care and the most scientifically advanced fertility treatments. We've grown from that one clinic. We now have clinics across the UK, and many people have become part of our care family with over 50,000 care babies in the world. But one thing has and always will remain the same. We care for each and every patient. We care about your dreams of having a baby, and we put our heart and soul into every aspect of what Care can offer you. To provide you with the best care possible and to give you your best chance of success and treatment, we look to our own care family. From our consultants, embryologists, and nurses to our admin teams and specialist fertility counsellors, we've also put a lot of thought into how we improve each and every step of your journey, which will no doubt begin with lots of questions. We know that thinking about starting IVF can be daunting for some, and that's why our care, patient services and support teams will always be there for you whenever you have a question, need advice, or simply want someone to talk to, so that you feel completely confident and in control of your fertility options. So yes, we have grown and developed over the years, but care and empathy are always at the heart of who we are. We are passionate about changing lives and creating futures, and I hope that this shines through in everything we do and everyone you meet at all of our clinics. We don't just care, we are care.
Okay, so I've just heard, unfortunately, we aren't going to get Professor. He isn't able to make it, having technical issues, which is a shame. But we've had quite a few clinical questions through. We do realise that, so we're going to aim to respond to them via email tomorrow. I can see that loads of your questions have been answered by the team behind the scenes, so I hope everyone feels like they've had their questions answered. There's one more video from me, but I just want to say thanks to everyone for attending. I hope it's been useful. I hope you've had an insight into what we can offer at Care. For more information or to book an appointment, you've got the number. Get in touch and just let us know how we can help. And I'll leave you with a few final words from Care.
One in 6 people need help to grow their family. You're not alone. And our Care family will do everything we can to help your dream of family come true. There are over 50,000 Care babies in the world today. And behind this success is our promise to make more heartfelt dreams of family become reality by ensuring our care goes into everything we do for all our patients every single day. You will receive truly individualised treatment, a patient-centric approach with empathy at its heart. We understand how nervous and excited you might be about getting started, but you can be assured of kindness, empathy, and all the information you need from our new patient inquiry team. We are all here to make it easy for you to take your very first step in your fertility journey. Call our team on 0800 564 2270 to learn more and book an appointment. We don't just care, we are Care.